Welcome to the Multicultural Media online briefing with Minister for Multiculturalism, Natalie Ward, and Dr. Jan Fizzell, Senior Medical Advisor for New South Wales Health. I'm Jesusa Halaratna, Multicultural Health Communications Service Deputy Director, and on behalf of New South Wales Health and Multicultural New South Wales, thank you for joining us today. We would like to begin by acknowledging the traditional owners of the land where we're meeting today. Dr. Jan and myself, we acknowledge the traditional custodians, the Cammeraygal people of the Guringai tribe of the Eora Nation. We pay our respects to elders past and present and emerging, and extend to respect to Aboriginal colleagues present. We would also like to acknowledge the elders of the multicultural communities represented today. So we would like to thank you again for coming online and for this weekly multicultural media briefing. We'd also like to ask if you can please mute and keep your microphones muted. As you know, we only have 30 minutes online today, so would like to ask the questions and direct the questions to Minister Ward or Dr. Jan. So we'll now hand it over to Minister Ward.
Thank you so much. Thank you everybody for joining. Can you hear me all right? We are competing for Wi-Fi in my home, so if it's glitchy, I apologise. I do hope you can hear me loud and clear. I might get a thumbs up from somebody if that's all right. Lovely. Thank you, Dr. Jan. Thank you, everybody. I also want to start by acknowledging the traditional owners of the land on which we meet, and acknowledge elders past, present and emerging. For me, that's the Gay and Margal people, and I extend that respect to those custodians of all of the lands and waters on which we meet respectively, and also to elders in our communities and religious organisations. I just want to start by thanking you all again for attending this important forum, and I just can't emphasise enough the essential role that you all play in communicating our vital health messages to our communities. It's so critically important. I want to make special mention this week that this is a significant time for our Muslim communities. Of course, for those who are celebrating Eid al-Adha, we know it's really tough to not celebrate this special time with your extended family and friends as you ordinarily would. But I want to thank those communities for celebrating safely with their immediate households only. And we're very grateful for them taking those steps, because we know that that's not been easy. So a special thanks to our Muslim leaders for sharing videos and resources and prompting communities to stay at home, and the stay at home message, which is so important this Eid. We're continuing to share resources in 60 languages promoting the stay-at-home health messages. We're holding very frequent forums with the community, online forums, and we're very grateful for, I'm sure many of you have attended those already. We're making sure we're doing that regularly and constantly, so that we can understand best how to get that message across to individual communities. It's really important that we reach into households and into each of those organisations individually, so that we can really make sure that we're addressing the particular health issues to particular communities in language, in the channels that they best understand. So I just want to thank you so much for your key role in doing that. It's just been so helpful, but it's all the more critical now. We really know that we're at such a difficult and critical time that we absolutely need to be getting that message to everybody in language. And we know that not everybody listens to the same. They might not be on social media, they might not speak English, they might listen to particular channels. They listen to you. And so we're very grateful for your partnership in getting those messages across. I just wanted to particularly thank each of the religious and community leaders for the translations, for getting the messages out and being very clear about the stay at home and get tested message. We know that it's a difficult and challenging time for everybody in different ways. We just want you to know that we are absolutely here for you, and we have resources available. Translation, the New South Wales Service New South Wales website is service.nsw.gov.au. And we know that there are a number of grants programs that I've been delighted to be able to progress through the government, and I'm really pleased that we're able to support the services of our multicultural media outlets operating in New South Wales. We had already committed $2 million to that, but we've secured another $2 million, so $4 million in total, to assist you to do what you do best, and we're very grateful for your work in getting those messages out. And I just want to particularly thank each of the outlets, radio, print, and all of the outlets, to get those messages through. Multicultural New South Wales will have more information about that shortly, but I encourage you to continue doing that, and don't hesitate to get in touch with Multicultural New South Wales, who have been working around the clock, and I thank them for their hard work. We have all been working really hard to get out there, so I know that we've had a number of people give us feedback, which I've been very grateful for, and I thank you for the opportunity to partner with you in getting the message out, and thank you for your hard work in each of our respective communities. So with that, will probably am best to hand to the expert you want to hear from, Dr. Jan Fizzell, but I'm happy to take questions afterwards. Thank you very, very much.
Thank you so much, Minister. Today in New South Wales, we've reported 110 new locally acquired cases of COVID-19 in the 24 hours to 8 p.m. last night. Of great concern to us, 43 of those people had spent some time in the community whilst able to give other people COVID-19. The virus is still spreading very, very rapidly, and it's spreading from person to person with great ease. We're so happy to see so many people in the community coming forward for testing. I think we had our highest number of tests on record yesterday, and that being the case, it's not for a lack of testing, it's not for a lack of community cooperation. I just thank everyone who's coming forward, who's being patient in queues, but those tests are still very, very important. People who have even the mildest of symptoms, people who've been asked to be tested by New South Wales Health, or people who need to have their surveillance testing done because they live in an affected area. Thank you so much for getting tested. It is so important. We now have new restrictions in place in a regional area for the first time since Easter, I think it is, and that is for the Orange City Council, the Blaney Shire Council and the Cabonne Shire Council areas until the 28th of July. This is after there have been people who've been infectious in those areas at some fairly large venues such as a Woolworths supermarket. We have seen transmission from person to person, even in brief contact in a setting such as a supermarket. So it's incredibly important that people remain vigilant for their symptoms, because some people may not have got symptoms, some people may not have heard our message. It's no matter where you are in New South Wales, we do need to follow the rules for our location, and we do need to get tested no matter where we are. It's really important that as the lockdown continues, the desire to get together with family or to see each other grows. We all are very worried about our family members. It's probably very normal for most of us to get together with family, at least on a weekly basis. We need to keep ourselves at home in our own household with only the people who usually sleep under the one roof there. We should, if we're providing care to others, do it very quickly, providing care from dropping things off at people's doors and stepping back. We're also asking the older members of our community to please be understanding when the younger members of the community are providing care. It's very normal for older members of the community to invite their family in and say, it doesn't matter, come, I need you. We really do need the older members of our community also to support the younger members, protect them. So please get that message to all members of the community. It's really important also that if people do have symptoms, they get tested and isolate till they get the results. If they're feeling uncomfortable and want to see a doctor or a chemist about their symptoms, get tested, call your GP rather than going and sitting in their waiting rooms. And if you need medicine, maybe get somebody else in the family to go and get those medicines for you rather than going to a chemist or to a doctor. We have seen some chemists and some doctors get infected when people have gone to seek care. It's really also important to know that we've now got some new testing in place for people who live in the Canterbury Bankstown local government area and who work as a healthcare worker or in an aged care facility. Those people need to start that 3 daily testing that we're doing for people in the Fairfield LGA across all sectors who leave the Fairfield LGA for work. It's still also important that the vaccine remains our best protection. And so it is so important that for people who are eligible, they should get vaccinated as soon as possible. There are good supplies of the AstraZeneca vaccine in many, many doctors' surgeries at the moment, and there are appointments available. For the Pfizer vaccine, many GPs are starting to receive it in their surgeries. If you go to some of the eligibility checkers and websites, you can find vaccine available. I saw one appointment in one doctor's surgery for 4 o'clock this afternoon. So there is vaccine out there, but you do have to look. And so what we've suggested is people look for a person in their family group, in their community group, who becomes their vaccine coordinator for them. They're the ones who go and look for the appointments and message their friends and family if they see something that would be appropriate and local for them, because these appointments do open up all the time. I'd also just like to thank everyone for their ongoing support of the health effort. This is beyond our contact tracing. This needs everyone on board. So thank you everyone who's doing everything they can to help protect people. And just remember, all the latest updates are always on the nsw.gov.au website.
Thank you very much, Dr. Jan, for giving those updates. Now we'll start with the questions. Thank you so much for those who have sent through your questions. We'll start them off by Adriana Simus from Greek Herald. Premier Gladys Berejiklian said this week that normal life could continue in the state if 62% of the population was vaccinated. What toll will this take on multicultural communities, and how will the government address this and help get the vaccination message out there? Minister Ward, would you like to answer this question?
Yeah, thank you very much. It's an excellent question, and I thank you very much for considering that. It is, look, I understand how difficult this is for our communities. I really want to acknowledge the toll that this takes and the difficulty that we all have in coping with this. I just wanted to say that we are very keen to get everybody vaccinated as quickly and efficiently as we possibly can, and that's why New South Wales has been very vocal about getting our share and trying to get more of the vaccinations here so we can roll that out. We've also pivoted to being, and Dr. Jan, I'm sure will speak more about this, I'm not the expert on it, but I know that health has been very keen on rolling out vaccination hubs wherever possible, and we are working on trying to get that in communities as soon as we possibly can. But again, we're restrained by simply the volume of vaccinations that we are given by the federal government, but we're very keen to get more of those. They are coming, they're not far away, I'm told. And so we have the hubs, we've got the hubs there and we're rolling those out. As soon as we get those doses, we will be getting them into arms as soon as possible. And we're trying to do that with people who are there who can translate, as we've seen in some of the hubs in Southwest Sydney. And we're trying to get our multicultural liaison officers out there as well. So we're wrapping around communities, but we're really keen, and I'm being very vocal about trying to get vaccination hubs in community centres, in communities where they can go and don't have to travel very far. So that's on the horizon. We absolutely are working really hard towards that. But I just want to acknowledge that in the meantime, we are all very clear about the challenge that we have. But I would say this, we've done this before, and I know that we can do this again. I know that it's difficult at the moment, but we have to pull together as a community to get each other through this. So I want to thank you each for getting that message out to everybody. And as soon as we can get jabs in arms, we're trying to do that.
Thank you, Minister Ward. We also now have a question that's addressed to Dr. Jan. Boris Grease from Russian Radio Australia said, our audience would like to know if old people who have a problem with mobility can receive a vaccine at home. If yes, how can they make a booking? And some of them tried to get information and did not succeed. The phone 1-800-571-155, correct number for bookings. But when you call this number, it goes to Queensland Business. Dr. Jan, do you have an answer to this?
So some GPs, as the supplies of vaccine become more available, will be able to actually offer in-home vaccination. But at the moment, I think the GPs are focused mostly on people coming to them, and then as soon as they can, they'll start taking it out. So if that person's regular GP has got the vaccine, it is definitely worthwhile trying to get an appointment with that GP and talk to them about options for having that vaccine at home. The phone number is actually correct. I did try calling it myself and found that the number was correct. So there's a lot of phone numbers flying around at the moment. So I think my advice to people would be just double check that we've got all the digits right and that we're actually calling the right phone number. It's really hard, I agree, to sometimes find the right number, but it's also on that New South Wales Health Vaccination Clinic Finder. You'll see the relevant number for some of those medical centres that are offering vaccination as well.
Thank you, Dr. Jan. We want to say hello to the Bayside Council, who said thank you for the translations, Minister Ward, and to our services. We also have a question here from Daily Chinese Herald. With the tougher lockdowns now imposed, when are we expecting to see the case numbers start to go down?
So we have a lag between an intervention and about 4 or 5 days before we start to see the effects of that particular intervention. One of the things that we are probably seeing is the fact that we haven't had exponential growth of these number of cases each day shows that the lockdowns are already having a significant effect. So we know that if we hadn't put those controls in place, instead of having 100 cases a day, we'd be easily up to 1,000 cases a day. When will we see the case numbers decrease? I think that's up to all of us. At the moment, the public health orders have their impact, but it's also how we follow those public health orders in spirit, as well as the letter of the law. So the more that we try and stay home as much as we can, and we don't go out, we don't visit other households. If we're providing care, we do it as quickly as possible. When we do that, the chances are that we will get those numbers right down.
Thank you, Dr. Jan. Here's another question from you. What's the vaccine policy regarding illegal undocumented migrants? Will our government give assurance that there is a channel for them to get vaccinated?
So the Australian government has made clear that anyone who is currently in Australia is eligible for a vaccine. And there are some particular centres like the State Vaccination Hub and some of the Commonwealth Government's vaccination hubs where you don't need a Medicare card at all. So there is access available. And again, when we're doing our outreach, we know that there are some people who may not have a Medicare card with them because they've lost it from whatever they're doing. We don't ask those questions. What we ask is about trying to make sure that the vaccine is safe and appropriate for you. So if there are difficulties accessing it, you will see that as the supplies of vaccine come through, we'll have more and more specialist clinics available in places like refugee services and community services. We haven't had the supply to be able to do that yet, but once we get that supply, that's certainly things that we're looking at doing.
Thank you for that. There is a question or a comment, Minister Ward. Properly and accurately translated material for communities will be great, but instead of online information, that is difficult to understand.
Yeah, thank you. I think I understood the question, but we are very keen to make sure that the message is getting out in language through as many channels as possible. And that's why we've taken out, front page advertisements in print, multicultural print media. And as well, we've run messages on radio as well. We've tried to be very clear that we want to get through all channels, and that's not just social media. It's literally in every channel available. And that's why we've also made them available, or further funding available, so that multicultural media can come to us and tell us what channels we want to make sure we're filling any gap and we're not losing anybody in that process. So whatever they listen to in language, we're trying to get out to them. So really keen to hear further if there's other opportunities to do so, but we have been really thorough as far as possible to date in getting full page ads, in getting through our multicultural radio at every level that we possibly can.
Thank you, Minister Ward. There's a question from Kiki to everyone. There are quite a few people wanting to get vaccinated in the community sector in the Hunter to be faced with no appointments available. When will community workers be added to the list of essential workers? Dr. Jan?
Look, I think if you're a community worker and you are regularly, and I mean regularly, caring for people with disability or who are older, you are eligible to be immunised. I will say that the supply constraints are there for all of us at the moment, and I think it's really challenging. But I do know that up in the Hunter, around Newcastle and in more regional areas of Hunter, New England, more and more GPs will also be getting a supply of Pfizer. So if you've got workers under the age of 40, do encourage them to keep checking the websites, because every day new appointments become available as new clinics get a supply. So it's really important that people don't sort of go, well, I looked yesterday and there was nothing, because today could be the day that we've had a delivery. New South Wales Health only opens up the hub for appointments when we have that vaccine ready to go into people's arms. And that is because we don't want to turn away, 10,000 people in a week because a supply didn't come through. So once we actually have that supply, it's in our freezers, we are ready to give it. That's when those appointments open up. So even if it looks bad at the moment, you may find that when that supply comes in, those appointments will open up again. But again, keep looking for local GP appointments and local respiratory clinic appointments. They're often coming up on a very regular basis.
Thank you, Dr. Jan. Minister Ward, there's a question here from Philip Einstein. Can refugees in detention like Villawood get vaccinated?
That's probably a question for Dr. Jan, but absolutely, we are not placing any limits on anyone in this country getting vaccinated. In fact, we want everybody to get vaccinated. I'm not sure about the timing of that. It might already be happening. It might be something that is already happening that I'm not aware of, but Dr. Jan might assist with that. But absolutely, I will be advocating strongly, but I don't think I need to, because we're very clear, both state and federal governments, we want everybody to get vaccinated as quickly as possible.
I have a question, Dr. Jan, about the Eid al-Adha is being celebrated now, and what are the rules and regulations and how we can celebrate this and how the community can make sure that they're celebrating safely?
So it's really hard if you're in Greater Sydney or in the Orange area. We can't go to each other's houses for prayers. We have to stay in our own house, and that means no brothers, no sisters, no aunties, no cousins. It's really hard because I know that this is a time for extended family to come together, but we do need to stay at home. So there are a number of different resources. I know many imams have put out messages for the community that's specific to you that can assist with celebrating Eid in a safe way, but also doesn't put your family and your community in danger. And I think that's the really hard thing. It doesn't matter which religion you are, which celebration is coming up at the moment, even if you have no religion whatsoever, that key message of stay at home, limit your mixing, and even if you're in regional areas, think very carefully before you do go out and mix with other people, because even though it's allowed, be careful to not bring COVID home, because, people in regional areas still need food delivered, they still need their fuel delivered, they still need supplies, they still need, medicines and things for hospitals to keep running. So we can't cut regional New South Wales out of New South Wales. There's going to be a risk to those communities. And while we're trying to mitigate that risk, we need everyone to be careful no matter where you are. But you may also have some helpful hints there, Jess, that have come to us from the community.
Yes, we have on the New South Wales Health Socials and the New South Wales Multicultural Health Communication Service and Multicultural New South Wales social platforms. They are being shared, and if you need some of those resources, we can supply them for you. They're in 13 languages and other languages as well. We want to also ask the question here, Dr. Jan, is should we ask for a certificate that we are fully vaccinated when we get the second shot? Is there a way for accessing that?
So if you do have Medicare, you can use the Medicare app and it will give you your immunisation history. You can also ring Services Australia to ask them for help if in a couple of days afterwards, or if you're not able to have the Medicare app, Services Australia can help you with a record of your vaccination. But do give them 2 or 3 days after that second vaccine, so just to make sure that dose is uploaded through all the different computer networks that it needs to go through.
Thank you, Dr. Jan. There is a question here, Minister Ward. Will you advocate for casual frontline workforce, mainly called women, that have hours reduced to be able to access support payments, even if they are accessing Centrelink benefits?
Yeah, thank you. I will, I appreciate that's a good question. I will always advocate for communities, and I appreciate the feedback. It's obviously Commonwealth guidelines around that. So that's something the federal government looks after, but I'm very happy to advocate for that if it's not already. We want to make sure there's assistance in place. We want to make sure that people are able to access those. So yeah, absolutely happy to be an advocate for that for sure. We don't want anyone left behind.
Thank you, Minister Ward. Hadil Saba from Iraqi TV Australia. Question, when will children in Australia get the COVID vaccine, and are they effective for kids, and is it safe?
So the really good news is that the clinical trials of the Pfizer vaccine in North America is showing that it's safe and effective for 12 to 16-year-olds. Already people who are 16 and over can have the Pfizer vaccine in Australia. Our own Therapeutic Goods Administrator, the people who regulate medicines in Australia, will be examining all that data. And when that information is clear, the Therapeutic Goods Administration will give the okay to vaccinate 12 to 16-year-olds. In the first place, we'd probably be doing what we've done for other people, which is to vaccinate the kids who are most at risk of having a severe outcome from COVID-19. So kids who have long-term health conditions, chronic health conditions, or kids who may be at home caring for a sibling, perhaps with another chronic health condition. But I'm not in charge of who's going to get the vaccine first, but I am excited to know that we will have at least for 12 and over. And again, information will come through about vaccinating younger children. But we do seem to see the older you get, the more likely you are to have a bad outcome from COVID, and you can still spread it at any age. So we do really want to make sure that kids are protected, especially because they do have to go out and about.
Thank you, Dr. Jan. There is a comment here from Sam Borka. Wish more was done to stop targeting the people who lost their mother yesterday. Their background, ethnicity, photos, home address were exposed in media. They were not even left to mourn peacefully. Minister Ward?
Yeah, I absolutely agree. And my heart goes out to that family, and my condolences to their family and community. It's it's an absolute tragedy, and I extend my sympathies to the family, because it's an absolute tragedy for them. They should be left to mourn and be given that privacy in that respect. We're making sure we're working really hard to extend the message to everybody to understand the health orders because of this. This is the impact it can have. So I just want to thank each of you for extending those messages out there. It's really important that we deliver those messages to people as quickly as we can.
Thank you, Minister.
Yeah, but I think, Jess, it's really important for us as part of the community to understand that in New South Wales Health, we don't divulge those details. You will have heard us talk about a woman in her 50s. So everything that the media can do to discourage people from speculating, to discourage people from publishing things that could be hurtful, that would be really good, because we want people to have that time to mourn and to process without people speculating as to what may or may not have happened for that particular individual.
Yes, thank you, Dr. Jan. There is a question here from Farougia. Will the vaccine protect new variants that may emerge? And I think that's on everyone's mind. That's a question that we would like to know.
Absolutely. And so we're getting some data out of the UK and the US where they've had quite high vaccination rates, which are showing some good protection against this particular strain that we've got for both the AstraZeneca and the Pfizer vaccine. So that's really promising. We don't know if COVID makes another big change, how effective the vaccines will be. But what we have now is the ability to modify the vaccinations, and we know they work. So this is the good news, that because we've got a vaccine, in fact, we don't just have a vaccine, we've got 4 or 5 different vaccines, we'll have that ability to actually protect ourselves against new variants. Now, there may be a lag time and it may be difficult, but we really are seeing some good data saying that there's good protection, not perfect, nothing's ever perfect, but some good protection with the vaccines that we've got here in Australia at the moment.
Thank you, Dr. Jan. Look, we only have 2 minutes, so if you have any more questions, please put them on the chat. Just a question about the testing, and how should we go about that in terms of getting tested every 3 days and moving around different councils or LGAs?
Sure. And look, I completely acknowledge that some people are finding the information difficult to process. I think I've talked to 3 different health colleagues, and sometimes they find the information difficult to process. So the current recommendation, the one group that absolutely must be tested is anyone with symptoms. You must get tested and go home and isolate. Don't go to work, don't go to the chemist, go home and stay away from everyone else in your family. Stay in a room, get them to feed you, but do not go out, do not do anything else but wait for that test result. There's also a group of people from New South Wales Health where we have told you that you have been in contact with a case of COVID-19. That group of people must be tested and follow the directions as to any additional testing that may be required. And then there's the groups of people who, because of their work, need to leave the Greater Sydney area and are going more than 50 kilometres from Greater Sydney, they need to be tested every 7 days, and preferably if they're going on a weekly basis in the time before they actually leave for that trip and get a result back. If you live in the Fairfield LGA and you leave the Fairfield LGA for work, you should be tested every 3 days. And if you live in the Canterbury Bankstown local government area and you work as a healthcare worker or in an aged care facility, you should also be tested every 3 days.
Thank you, Dr. Jan. Minister Ward, we have 1 minute. Any final thoughts?
Yes, absolutely. I just again want to really thank each of you for the great work you are doing and continuing to get that message out to stay at home and to get tested and to get vaccinated as soon as you can. It's just so critical that our communities hear in their own language from you and through your channels and from our religious and community leaders who I acknowledge have been working so hard with us. I also really want to acknowledge all those hard workers at New South Wales Health. I don't know how Dr. Jan manages to do it, but we are on Zoom meetings all day long and she's constantly updating everybody, and all of those teams, all of those people that are working so hard behind the scenes, they have families as well. And I just want to acknowledge their very hard work in it all. But to each of you, thank you. Please stay well, stay home, and we will get through this. And I look forward to us getting through this and being on the other side and being able to see each other face to face again very soon. And thank you for coming to these forums.
Thank you, Minister. Dr. Jan, any final words?
Just thank you, everyone. And anytime there's any feedback, do send it into our media team or to our communications team. We're happy to respond as quickly as we can.
Thank you very much, everyone, for joining us again here in the Multicultural Media online briefing. We'll try to do this again next week. Apologies from the Minister for Health, Minister Brad Hazzard, and Dr. Kerry Chant for being here, and hopefully they'll be with us next week. Thank you so much, everyone, and please stay safe.